So vitamin D, it's a fat-soluble vitamin. It's different from vitamin C because I know we talked about vitamin C in one of our episodes. Vitamin C is water soluble. Vitamin D is fat soluble, and it's important for us to grow a healthy skin, healthy bones. It packs our immune system. It's a vitamin, guys. So a vitamin is something that you, I guess, you would ingest vitamin D. It's not active in its a regular state where you get it from the sun or from food. It's actually gets activated once you digest it, and it gets activated in your liver. And like I said before, this is very important with bone growth and tissue growth and skin growth. Because as nurses, we all know that we need vitamin D to absorb the proper amount of calcium and phosphorus, and that's what kind of stimulates our bones to grow.
Also, for those patients that are getting older, naturally what happens is we lose the calcium deposits, right? So we need more and more vitamin D, especially if you're more up north. We talk about like the winter blues, right? So I wonder, I'm sure there's a correlation between maybe depression and vitamin D, but nothing is linked directly. And vitamin D, we don't have enough research on it yet. But let's just say we talk about the winter blues, how people get more unhappy, get depressed. It's interesting how in winter we need more vitamin D. So it's a perk if you live up the warmer climates.
And there's actually two types of vitamin D. There's a vitamin D2 and vitamin D3. And if I'm not mistaken, the vitamin D2 is derived from plants, and vitamin D3 comes from the sun. So you go get sunshine, you go outside, the sun hits you, the radiation. I'm not sure what kind of rays those are. I'm not sure if is the sun gamma rays. I'm not sure if they're gamma rays or not. But the radiation from the sun causes you to develop vitamin D. And it doesn't really matter which form you get it from, because they both get absorbed and then they get turned into a different active vitamin D in your liver. So both vitamin D2, the one you get from plants, and vitamin D3, the one you get from sun, they both get absorbed and they both get turned into this active vitamin D in the liver. And since we're on the topic of bones, so when people are deficient, or when kids are deficient in vitamin D and their bones don't grow properly, that's called rickets. And then in adults, sometimes vitamin D deficiency causes a weakening of the bones in adults, and that's osteomalacia, I believe it's called. Yeah, osteomalacia in adults. And those kind of are like the main things that we've probably heard from poor diet or lack of vitamin D in our system. And then you were talking about the winter blues, and that's true, because especially for us night nurses, like we work when it's night outside, so we don't get any kind of sunlight when we're working. And plus, when we go home, we go to bed. So we're lacking that sunlight as we sleep as well, because we have blackout curtains. We don't want the sun in our room while we're sleeping, because that's going to wake us up. So night shift and vitamin D, there's definitely some kind of correlation between those two, because we're definitely not having it absorbed by our skin and by our tissues, and we can only get so much from our diet.
And it's kind of interesting, because the way we were created is we are meant to be up during the day to absorb this natural fuel. What if it's like a super nutrient that we're going to find out in the future that we should have been taking? And like currently we don't have like guidelines that tell us exactly how much you should be taking. Like the government recommends 400 to 800 international units. So that's like 10 to 20 micrograms. But there are studies that are saying you need 1,000 to 4,000. So it's like we don't have a clear definite, but we definitely should be taking it as a supplement or getting enough sunlight, because it is linked to potentially less cancer and less bone fractures and some other things that like heart disease. It's saying our like U.S. government is not saying it's directly, it's preventative, because there's not enough study to back it up. But I think there's a pretty good correlation.
So the main, so when we think of vitamin D, the main thing we think about, as individuals is usually bones, calcium, phosphorus. But I think it was like the 1960s or 1980s, a scientist actually discovered that vitamin D also plays a role in immune cells. Certain T cells and certain B cells have an adaptation for them to attach to vitamin D, and they use vitamin D to function properly. And over the years, studies have shown there's a correlation. It's not a really big correlation, but there's a correlation between vitamin D deficiency diets and vitamin D deficiency levels, and Crohn's disease, IBS, and even cancers, and even lung capacity and lung diseases.
Wow, man. It's a super nutrient, guys. I think we should be consuming it possibly. I kind of wanted to find out. It's kind of funny because I went to the doctors and I got my vitamin D level checked because I was thinking that I could be deficient. Maybe I'm more tired during the night shift after 2 years. I didn't find anything. It says my levels are good. What the problem is like, I wonder what kind of scale they were using to tell me if I'm good in like the percentage, because I think in Canada, they say you need 75 nanomoles per liter. I don't know what the American standard is. And I wonder how they were using that as a medical, what is it called? As an indicator if I have low vitamin D deficiency. So honestly, I might look back at it when I'm back in Chicago.
Do you know if they look at your vitamin D level, or maybe they look at your calcium and your phosphorus levels? And when they found that the calcium and phosphorus was normal, they figured, hey, your vitamin D must be normal as well.
See, I actually asked for vitamin D test itself. So I looked at it and I just cannot remember the lab value. I'm going to definitely check back and I'll let you guys know about it.
Yeah, because I'm not sure if my doctor, because they don't do it on a routine panel, right? Vitamin D. I don't think so. But
You
there's
have to ask
patients.
for it.
Yeah, but there's patients in the hospital that get a vitamin D. I think it's an injection that they get, or I don't know if it's a pill. I'm not sure, but they take it like every 2 weeks, I believe, if the patient gets it. But I know there's some kind of a vitamin injection that they could give in a hospital, but I could be mistaken. I think that patient might have had a pill version though, but he takes it every other week. And even myself, I take vitamin D. I'm not sure how many milligrams it is, but I do take a daily vitamin D just because I work nights and I don't feel like I get exposed to the sun as much as I should.
I was taking supplements for a little bit of time and I kind of fell off. You know how you like order a bottle of multivitamins and then you just stop taking them and you don't reorder? That's the habit I got on. So maybe I should just tell Alexa, or I should have like a subscription service where they just keep sending it to me to stay on top of it.
Is it because you forget to take it, or you just forget to reorder it once the bottle runs dry?
The bottle runs dry and I just throw away the bottle. And then Matt's like, oh, I should need some vitamins. And here we are thinking about this idea.
Yeah. So for me, I've sometimes had an issue with forgetting to take my vitamins. So I just put them right to my nightstand, where my phone is on my nightstand, because I usually have like a beaker of water before I go to bed, and I leave it there. And usually when I wake up, I put my vitamin container is next to that beaker of water. So when I wake up, I know to take them. Because I know sometimes when I'm in a rush, if I wake up late or I'd say a lot of stuff to do, like we sometimes neglect taking the vitamins, and we kind of just skip them over just because you want to save the extra minute, or you just forget. So like right from the morning, right from the get go, I just wake up, take the vitamin, and then I'm set for the rest of the day.